All right, we're gonna get started. We have a small group, but hopefully more will join. But we're also recording today so that we can put it on our LMS. And also for all of you, if there's an element that, next week you're kind of wondering about, you will be able to go back to the LMS or the slides that we'll send out and just like check back in. So I want to say thank you for joining us. We're very excited for this next phase of the coordinated entry sort of efficiency that will happen in Clarity. What we're doing here is a 2-week beta testing period. So basically, the beta testing period, we're going to talk about today what the beta testing period is. We're going to also talk about what we're asking you to do. We're going to go through all of the different tabs. So if you, in Clarity, there's a level of tabs for clients. And then if you go into a program enrollment, there's a level of sort of tabs. So Community Queue and Referrals have a set of tabs as well. So we're going to go through the Community Queue tabs. And then we're going to go through the referral process step by step. So the intent of the hour we spend here is to get you acclimated to the process. And then the good news is for the next 2 weeks, we have a check-in every single day at 4 o'clock. If you can check in live, it's like a Google Meet. You don't have to, but if you have questions or problems or some comment about a way we can try to improve the process, that's a good time to kind of come into a meeting and check in with us. We also could just have you send a help desk ticket that, describes whatever it is that your question or problem is. So there's going to be a lot of opportunity for you to provide us with feedback and for us to support you. I was just talking to Tucker. We're going to try to set up maybe on Monday a couple of times, one for the shelters, because Monday will be the first day that we're going to roll out this process. So we might have a time Monday that shelters can pop in to start setting up their availabilities. And then we'll have another time for the call center, Pete, for the matchmakers to go ahead and make the referrals once the openings are all set. So we'll have maybe an extra time Monday where we actually can walk you through the step by step. All right, so first, what is beta testing? So whenever you roll anything out that's new, it's a good practice to do some testing, make sure there's no glitches. Again, identify any efficiencies with workflow. Just make sure our training slides are, updated and provide all the information people need. So that's what we're going to be doing for the next 2 weeks, is hearing from all of you and having you practice all of these, the process of identifying your bed availabilities in your projects, and then practice for the call center to refer people into those bed availabilities. So we'll have 2 full weeks. It's actually, I think, closer to 3 because of the Memorial Day holiday. So we're going to train everyone in the whole system on June 2nd. And every single shelter will start using this process on June 7th. So there will, if you have partners at your shelters, like Terry, you're the shelter referral manager for Pine Street, but if you're on vacation, there may be someone else who will pick up the slack. There will be plenty of opportunities for all of you people that you work with to sort of get trained so they can cover for you, so you can have vacations or if you're out sick. So that's what the beta testing process is. Any questions before we keep going? All right, this is a super informal training, so just unmute and ask your question or put it in the chat, whatever. We want to make sure to answer any of your questions as they come up. All right, so first is when you're in Clarity, and so I've put myself into the Youth Pride Agency for the purpose of this all of these slides. So that's what you'll see. You'll see my name and Youth Pride. But from the home page or your search page, you have to first be in your own home agency. So you will not be in the coordinated entry agency. The call center matchmakers will, but like, for example, Terry, Marie, you will both be in Crossroads because that's where your shelter project is. So you want to be sure you're in the agency that has your shelter project. Yeah.
Jen, I'm so sorry. I just got a call. I have got to sign off
Okay.
because I was supposed to be on another meeting that isn't on my calendar.
All right.
I will have to catch up with Alex and Savan and go on LMS for it. I apologize.
No worries. We're going to record it just for this purpose. So we will, I'm sure we'll be talking to you over the next 2 weeks.
Thank you.
Take care. Okay. So from your search page, you're going to toggle, or not toggle, but click on your referrals icon here. And this is going to be the image that comes up. So this is the referral tab. Just as a information, not all of you will have all of these tabs. This is every single tab, and because I'm a system admin, they're all visible to me. So depending on your access level, depends on what tabs you actually see. So everyone will have the tabs they need to do the work for referrals and matchmaking, but they will not necessarily have every single one of these. So we're going to go tab by tab. Even if you don't have all of them, I think for transparency purpose, it's a good idea to talk about what each of these tabs do and what information is contained there. So when you click on the pending tab, so once you get to referral, the pending tab's here. It functions just like the client level tab, just like the program enrollment tabs. You just click on it. When you click on pending, this is where you're going to see all of the pending referrals to your agency. So we cut some of these images are a little blurry because we don't have referrals in our live site, and we are not setting this up in our training site. We're going to actually copy it into our training site later. So some of these images are blurry. I apologize because they're from BitFocus. But long story short, when you click on pending, this is where you see any referrals to your shelter program that are pending. If you are someone who has multiple shelter programs in your agency, you'll be able to sort these pending referrals to your agency by program. So for example, Crossroads, you'll be able to sort them by Harrington Hall, Women's Center, excuse me, Pine Street. So they will come in order of project alphabetized. So that would be something important of Alex and Savan to note for all of your shelter programs. Then what you do is from this pending tab, and we'll go through it once we go through the process, but just for a little quick how this tab functions, you actually click on the client name to be able to go in, accept the referral or whatever you're doing with the referral. And then you can, certain matchmakers will be able to edit a referral from this tab. I think at this point we've identified just a very select few people that can actually edit a referral. And then you also can edit the edit features where a project can actually also go in and deny a referral if it's not appropriate. All right, so we're going to pop over here to the next tab, which is Community Queue. So the Community Queue tab is an easy slide. It's only going to be visible to the CES staff, which are identified their access role as matchmakers. So those are the people who every day will be viewing the availabilities the shelters enter into the system, viewing the people in the shelter queue, sorting by eligibility and other tracked characteristics, and making referrals to each of the beds. That's what the function of the matchmaker is. So that will be only available to the matchmakers. Next tab is analysis. Here's our favorite octopus, all of us. The analysis tab is not set up yet. And again, it will only be limited to only certain roles, certain access roles. But if someone does click on it, you're just going to get the error page. All right, next tab is completed. So completed tab shows referrals that were made and folks that were actually enrolled into a shelter program. So it displays client level data, including the referral date, the date the client was connected, and then also the number of days that the referral was pending. We're going to talk about the number of days and how to address that later on in the slide. Denied. So the deny tab, and I literally took this language straight from the BitFocus help articles. So those are very helpful if you are running into an issue or need some more guidance. Those articles are really helpful. So there are several circumstances that will cause a referral to display here in the deny tab. The status of a referral directly made or reassigned to a program could be manually updated to denied. The referral could be in the denied tab if the referral was made to the queue and reached the inactive referral expiration threshold. So to be clear, we've set the shelter queue expiration to 30 days. When this occurs, the status field is updated to expire automatically. If there's a referral from the community queue to a program with a status of pending or pending in process, and it's reached the community referral threshold, then it would also display in denied. So that would be Jane Doe is on the shelter queue. The matchmaker identifies Jane Doe is a great fit, and the next person acuity-wise to go into Crossroads Women's Shelter makes the referral. The referral is pending. If Jane Doe doesn't enroll in this women's shelter project or go into the bed within 3 days, then that referral will expire, and that will cause this referral to show up on the denied tab. You also will need to check on referrals when the threshold is reached to keep the referral active. So this happens all the time. Alex, this will be an important thing for you to be sort of helping the shelter, like connect street outreach to shelter. So sometimes someone's referred to a program and the street outreach team and or shelter coordinated entry can't reach them. They're out in a place not meant for human habitation, their phone doesn't have minutes. So it may take more than 3 days to get that person into shelter. That's where this function of going into the referral, and we're going to go through it later in a later slide, Tucker's going to go through it, but there's a process where you can sort of check in on the referral and extend it. Same for if someone is next to go to a shelter bed and then we learn they're in a hospital placement and they're set to come out in 4 days. If we want to hold that bed for that person, we can go in and update the referral to make it last longer than the 3-day threshold. The status of the referral directly made or reassigned to a program could be manually updated to expired, and it could be due to the referral expiring based on other criteria or the event of data entry error occurred.
I have a question.
Yeah.
Sorry, this is Marie. Are we going to reserve the bed when they're in referral status? Like if you've made the referral, we've got it. Are we going to reserve that bed for 3 days? And that's going to show as not eligible. I mean, not open. It won't be an open bed. If somebody's referred, we're going to hold their bed for 3 days.
So that's the way it's set up. That doesn't mean that you can still, you can in terms of your policies, right? Like that's the general community threshold setup. Like you could when there's a referral made to the active unit, like if you know before 3 days that that person is not actually going to come in, you can deny them earlier.
Okay. So if somebody's coming in and they've been referred and I don't know anything, I'm just going to hold that bed for 3 days. Is that correct?
That's like Tucker said, that's the way that the system is set up, but each individual shelter has a different set of policies and ways. You're going to manage that bed the same way you are now. If Pete's team is referring someone to a bed today, however you manage that bed and referral is how you will continue to.
Thank you.
That's just like the actual back settings that we've set in our system is 3 days. We're not trying to impede anyone's policies or procedures.
And I'll also add, this is Amy, Marie, we're working on freshening up our CES policies and procedures manual. So at some point we'll do information sessions and get feedback from all you wonderful shelter providers and try and come up with a systemic number of days that we're keeping those beds held. I think right now in the manual, it is 24 hours. But if you guys at that point in time have feedback that we should make it longer or less time, let us know.
I'm hopeful that, we'll still have the ability to make that decision. Like if somebody calls us at midnight on the 3rd day and said, I'm coming in, I can hold it the 4th day. Or if they, something else. Thank you. That's good.
No, that's a really good point, Marie. If you have a bed and you have a human person and it's midnight, absolutely, just like you would now, you would put that person in the bed and then make sure to circle back with coordinated entry team the next day. You would do the same thing.
Thank you.
Mm-hmm. And certainly these settings are just like the default settings that we've set up, and as we go, we're going to see what works best for our system and what reflects in our policies and procedures and make those changes. So
and we wanted to also give a little bit more time in terms of just the system settings, because while you at Harrington Hall and Pine Street might be doing things really close to real time, if there are the referrals for instance, we know that it took a few days for Ben's team to get out to the hotels that after they were referrals from CES to the family hotels. So we wanted to give a little bit of a buffer in the system, although it's still better, it's much better for the system overall if you're doing all of that denying people who aren't showing up closer to real time when you get that information, if you're sure that in those cases. We want you to put as much of we would rather see you guys proactively put things in about the referrals rather than kind of just wait for things to expire.
Okay. So any questions about denials? Okay, we'll keep going. So we're going to cover these next 3 tabs, and then we're going to switch over to the actual process. So sent. So again, this tab will be visible to the CES staff, like the matchmaker staff, and it will list all of the referrals that have been sent to the various shelter projects. Oops, I'm sorry. I still need to get new batteries in my mouth. So the matchmaker staff will be able to use these search criteria to drill down and sort all of the referrals by these various criteria. Next up is availability, and this is where most and it's blurry because this is, I don't know why it's blurry. This is our own image. But this is where the program staff, the referral manager from the shelters is going to be going in and sort of notifying the system of the available bed. So you can, Marie McGee, here you are. You can add a single opening. So for example, a family shelter has one room that comes open, that would be a single opening. But if Marie has 3 top bunks, 2 bottom bunks, this is where she's going to add multiple openings. So that when you add multiple openings, and we're going to go through that later, but they have to have the same descriptor. But you can do, you probably likely will be doing a couple of multiple openings per day. That's how you would be doing that. I think the same would happen for the Pine Street program as well. So this is the availability tab, and then there's an open units report. And this report will be the report that the matchmakers, the CES staff, will be looking. And of course, it's all zeros now because we don't have openings identified. But you would actually be able to go in and look at all of the emergency shelter programs, what their openings are, and other criteria for those openings. So that's where the CES staff will be searching for the openings. And then once they search for the openings, they'll be going into the queue to look to see who's the next person to refer into those openings. All right. So we're going to switch over now to the referral process step by step, and Tucker is going to walk us through it.
Sure. So the way that this process will work is that first in the morning, the shelters will identify how many beds they will have open that night, and they will enter those openings into the availability tab in referrals. Then the call center matchmaker staff will check, see how many openings there are. They'll also be notified about openings that get added, and they will make a referral from the queue to that opening. Then the shelter staff will see a notification that they have a referral that was sent to their program, and they will go to the pending referrals tab and review and accept them into the project, and or deny them. And so the way that you accept them into the project is you enroll them into your program. There's not an intermediate step. You just will click on the client's name and enroll them into the project. Or they can keep the referral as pending and check in on it if they want to save that bed for the person, or they can deny them if the client doesn't actually come or says or is not eligible for some reason. And at that point, the CES team will re-refer people to the opening that will open back up again because the person who was referred to it was denied, and the person who is denied could be referred to another opening in the system. So to get to the openings, you're going to, from the search page, click on referrals. And the openings are, it's right below your name and program information. It only comes up while you're on the search page. If you're on a client page, you have to go back to the search page in order to see that referrals tab pop up. That's a little hint. And then on availability, you're always going to want to toggle over from the housing queue to the shelter queue. The shelter queue is the one that we're configuring now. And you'll note that all of the projects should be set to limited availability for in shelter. That if it's under full availability, then the matchmaker staff could make could make a referral even if you didn't have any open beds. So you want to make sure it's just on limited availability, and you don't want to toggle back and forth between limited and no availability. Just leave it on limited availability, and then when you enter an opening, they'll be able to make the referral to it. So in there, it will show your current openings with or without any referrals that have been made to those openings. And you'll see the buttons for add a single opening or add multiple openings. So single opening if there's only one of that kind of bed there, multiple openings if there's more than one of that kind of bed or room that are identical. So when you pull up single opening, you'll have the date that it's available for, and there are additional notes. So the additional notes, the date and the additional notes are actually the two pieces of information that the matchmaker staff can see when they're in the actual assigning the referral page. So you want to make sure that you put, top bunks, or any other information in there about it, especially for family units. You want to put, the detailed information about what that unit can accommodate in that additional notes. And then there's also the additional toggles and metadata about it. And we haven't incorporated it yet, but all of the toggles and numbers that are in below the additional notes, those will be the things that show up on the open units report when that's fully configured. It's not quite fully configured yet. And you'll just click Save Changes, and that will add that opening to your program. The multiple openings is the same, but there's a number of openings to add at the top there. So if you have 2 top bunks, you would put 2 in the number of openings. In the additional notes, you could write top bunks, and then check off is the bed a top bunk. One point there is that if you're a congregate shelter, the number of people that will fit in this room, that's really not a field that's designed for congregate shelter. That's really for family shelter or hotels. So there's only one person per opening at congregate shelter. You don't want to kind of have more than one person. And when you add multiple, it's basically going to add it's going to add one opening record for each number of openings that you put in the top, and all of the information that's below it will be identical. So you can't, so if there's something different between 2 of the openings, you need to add those as single openings or multiple openings with each set of characteristics. So usually that'll just be number of top bunks, number of bottom bunks. But at Pine Street, it could be the number of men's beds and the number of women's beds. Something like that. Does anybody have questions about the opening?
I do. Marie McGee does.
Yes.
I'm
Yes.
a little confused on that, multiple openings.
Yep.
If you just could go back to that, because if they're all going to be a one opening, I mean, they're all going to be a single down there on the bunk. Like if I'm going to I have
Correct.
3 beds available at the top.
Yep.
Then I'm going to go to additional notes. Okay.
And you would write top bunks, basically.
Top bunks, 3 top bunks.
Yeah. Yeah, but you wouldn't put the number. So it'll create. Yeah, no. So when you put 3 openings in, it creates 3 different records that are all the same. And then when the call center staff make the referral, they refer to each one of those different openings, a different person.
Okay. I think that's going to be something I'm going to have to wait to be able to look at it with my.
Yeah.
I think I understand.
So if you have multiple beds, but they are the same in characteristics. So if you have 3 top bunks, the multiple openings option is where you can put 3 top bunks, save it. And then if you have 2 bottom bunks, you would then go in and add multiple openings and put 3 and then bottom bunk. And then save those changes.
Okay, so it's
And
gonna
the
be
same
2.
for, yep, you would do 2, if you had 5 beds and the makeup was 3 top bunks, 2 bottom bunks, you would add 2, you would go into add multiple openings twice. The first for the set of top bunks and then the second for the set of bottom bunks.
Thank you. Thank you.
If you had, so what Tucker was saying is if you had 2 bottom bunks and one was like, I don't know, like, one was, not that this would happen, but if you had a bottom bunk that was on a 2nd floor and a bottom bunk that was on a basement level, and that mattered for handicapped accessibility or something, that would not be one single multiple opening because they're different. They would each be, you would have to add them separately.
So that brings me to when a referral is coming in and it's a person in a wheelchair, we have a certain section that we put the wheelchair clients in. Now, that would come from the person, the CES person that's going to be adding the referrals for them to say, this person's in a wheelchair. Could I get a phone call on that? Or is there a way to specifically say, this person needs a wheelchair, and then I can look and I can say, okay, the wheelchair area is full. We can't fill that.
Well, yeah. So if you have an opening that, right, like, so if you have an opening that is in the wheelchair area, right, like you could say, you could add a single opening, and in the additional notes, and in that opening, you check off handicapped accessible and say, and in those notes, you would write bottom bunk in wheelchair area. And that way, and then when we'll get to how the matchmaker staff are doing it, but they can include a note about the handicapped accessibility, and it would show up in that pending referral in a way that would be easy for you to see.
Thank you.
That's a great question.
Hi, this is Meg. I just have a question about where is the program indicating male or female? Is it under additional notes or?
So in the case of, so it's going to be a combination of notes and program eligibility. So when you are making a referral to Harrington Hall, there won't be any women who show up as eligible for the program already, because the program eligibility is set up for that. But for instance, at Pine Street, rather than them putting in top and bottom bunks, they would add men's and women's beds.
Okay.
Does that make sense?
Yeah. Thank you.
That's a good question, Nick.
Yeah, it is a good question, and it is kind of dependent program by program. So
Okay.
Okay. Any other questions about the single, like add a single opening or add multiple openings before we move on? Okay.
So when you add, after you add the openings, it'll take you, you'll be right back on the same page, but each of the openings that you've added will have the information about that opening right there on that availability screen. So first it will show the available openings. So the ones that you've just added will all show up as available. And there will be, like I was saying, if you do multiple, there will be one copy for each of the openings that will show up there. So if you've added 2, it will show 2 top bunks. If you've added 2 top bunks, it will show, 5. It'll show May 12th, top bunk, top bunk. And then below that, once there are referrals made, that it'll show that those are reserved openings that have not been completed yet. So when there is an opening, there will be a notification that goes out, copied to the email and to the Clarity inbox, and that's how the CES team will be notified that there's openings added, and they've already been notified some as we've been testing it out. And this is how it looks in the Clarity inbox from inside, from the messaging. And so there'll be notifications that pop up in there that there are inbox messages about opening.
Yeah, so the opening notice goes both to their email, the email that's in their Clarity account, as well as the internal account.
So for the matchmaker staff, as basically when the CES team is notified about all of the openings, they'll pass that information about those openings on to the matchmakers who are going to be making the referrals for the day. So the matchmakers will go into the community queue and they will select the agency and program that has the opening. So if Crossroads has the opening, they'll select active agency on the community queue for Crossroads. So you'll select the agency and then toggle on eligible clients only and select the program that the opening is for. And you'll also want to make sure that you're on the shelter queue rather than the housing queue, because there's not going to be any openings in housing right now. And always select, so after you select the active agency, program, eligible clients, then you're going to select crisis assessment processor as the mode. And what that's going to do is sort the clients by their crisis assessment score. And you can click search. There are additional settings for changing the sorting, and the key one here is that there's a characteristic here, and so that characteristic is a filter so you can apply any of those as filters to the eligible clients. So that's basically additional eligibility that's about that particular opening. So if it's a top bunk, you want to select, you would select in characteristic, okay on top bunk. And that way you would filter out all of the clients who have not had that, who are not toggled to be okay on a top bunk in their crisis assessment. All of the things there are some things also in there that you probably wouldn't use as filters, but they'll show up as a badge next to the client's name so you should always look at so if you go to the next one, I think shows. Okay, no, we haven't done this because we can't show the queue because it all has in the slides because it's all full of actual clients. But basically it's sorted by highest crisis assessment score, and a lot of the clients will have a little icon near their name, and if you hover over it, it will show all of the characteristics that are set up. So like okay on top bunk, if they don't have any, if it's a family shelter, if it's a family, if they don't have any criminal charges, that question from the crisis assessment is toggled to no. If they have any pets, there will be that'll show up in the badge, and if that pet is a service animal, that will show up in the badge. All of those things will show up in that little icon that's next to the client. So you want to always check on that when you do so. We'd also recommend that, so there's to the left of the client's name, there's an edit button, and then the client's name themselves is a link to the client profile. So we generally recommend you right click on the client name and open the client profile on a new tab while keeping the shelter queue open so that you can kind of do both at once. And that way you can double check that there's nothing in the event notes that might lead you to not want to refer that client to that opening at the time, or a public alert that you might want to read, those kinds of things where you might want to skip over that client while you're going through to make the referral to that opening. And also household composition, so making sure that the household composition is appropriate for the opening. And once you do that, then you can click back over to the tab that you should still have, then you would still have open that's on the queue, and you can, then we'll go on to the edit button, which is where you will assign that referral to the program opening. Stuck on this slide, Jim? Okay, there we go. Yeah, so that little edit to the left of the client's name, so the client's, okay, yeah, so the edit is there, the client's name is there, so that's where you can right click to get to the client profile, and see next to the referral date, there's that little, looks like a little icon of like a driver's license. That's where you would see those characteristics that we've configured to be kind of flags about, that have additional information about the client.
Okay, I actually have navigated over to this page. So we can show it live.
Okay.
So I searched for Tessie so that none of the other actual live names came up. So you won't be searching by name. Well, maybe. But basically, here's Tessie Tester. The icon doesn't show up until you hover over the name. And then this is where you will right click and open it in a new window. And your second window will show up. And this is how Tucker was reporting that you can look to see, is the household appropriate for your opening. And you can also go in and look at some of the event notes just to be sure. You know, sometimes that's where there's some detail that might determine that they are not eligible for that particular bed or for your program. And then you can just toggle back over here to where you were in the community queue without losing your place. That's great information. Thank you, Tucker.
Yep.
Right.
Yep. And so then if you click through to the edit, that's where, yep, will take you through to the edit, to the assign, to the information about the referral. So at the top, it will show how long, when they were referred to the community, to the shelter queue, when the last activity was with the client, which could be anything. And that's the check-in button there, which we wouldn't check in on the referral to the queue, but if the referral is to your program and you want to keep that client open, that check-in button is what you would use to check in with them and say that you're still holding the bed for them if that's what you're doing. But the reassign is where that's below. That's where the matchmakers will be able to select the program and this particular opening that they are sending that they are reassigning the referral from the queue to that particular program opening. And when you select the program, so let's say Harrington Hall, then it would show the openings there, and it would say, it would have the date that opening was added and any of those additional notes in it right in that line. So that's how you'll select whether you're sending that client to the top bunk or the bottom bunk, or whichever opening is the one that's corresponding. And then click Save Changes, and that will take you then to the pending. It will then take you to the pending tab of the referrals, because that referral is now pending in the program. And at the shelter agency, they'll also now see that referral show up in the pending tab of the referrals. And they will also be, the assigned staff at the program will also be notified about the pending referral to their program. So for the referral managers, when they get that notification, they can go back to referrals, and I think there's actually a link in the notification in Clarity to open the pending referrals tab, or you can get to it back the same way we were saying about the navigation, and we'll then see all of those pending referrals. You can sort by program name and see who's pending to your particular shelter program, and you'll see the information about the client, who it is. You'll see any of those characteristic badges under the badge there. And it'll always show as qualified reassigned for the referrals that come from the shelter queue. And so, yeah, we go to the next page.
I had a quick sorting question. So I see that you can sort by multiple criteria. It looks like, program name and then characteristic.
Yeah.
So like for Harrington Hall, it's men only. So we would want to sort by, like acuity and men. Is that a part of the characteristic?
So the characteristic is actually going to filter it. So you could filter it by doing the top bunks first, and then getting those people in, and then those people would come off of the pending referrals, and there would be the people in the bottom bunks left. That's kind of how it could be used, but it shouldn't be too long a list each day.
Sorry, I thought I had a slide for the list. I'm so sorry, but I can show you. This is what the list of characteristics you can choose from is.
Yep.
I'm sorry to interrupt you, Tucker.
So gender is not included in that?
Well, no.
No, but it would be by program, right? So
okay, I got you. Okay.
Yep. So if there's multiple programs, you can sort by, click on program name to sort by it, and then it'll show Harrington Hall.
Okay, so if it's a male client, then or if there's a female client, for example, Harrington Hall wouldn't even be an option for the matchmaker.
No. Yeah, so it sorts by eligibility and then secondary by tracked characteristics. So Tucker and I went in and configured every shelter. So Pine Street is probably the trickiest because it has women, it has men, and it has couples. But there's some shelters like CCA, their family shelter will only pull families. You know, so the gender and household composition is part of the eligibility. And then the tracked characteristics are those sort of secondary questions that we ask on the crisis assessment on the shelter preference part.
Okay, great.
Yeah, no, that's a great question, actually. And even though this is like the back end, like the matchmaker piece, we put it in the training because I think for transparency, it's really helpful for everyone to see how it's all happening. Like every step, even if this isn't a step right here necessarily that everyone's going to be taking, it's important for everyone to see that. That's good.
Yeah,
Okay.
so you should just look at all of the people who are pending in your agency to your program. You shouldn't be filtering this, because if you filter out people, then they're just going to sit as pending until they expire, rather than having their record touched. And we want everybody to we want as much as possible folks to be like going into each referral and making a positively determining what's going on with it, especially during this beta period, because we want all of that feedback, right? Like we want to know if we want, you know, the system to be able to make the most appropriate referrals possible. So if and we want to know why referrals aren't going through proactively. And if it is due to no contact, then we want to know that. If it's because it's hard to find folks or whatever, we want that information during this period, definitely.
Okay.
So Alex, that's a perfect lead in. So we put this slide that says, do not filter your referrals. So if the queue and the matchmaker sends you 10 referrals, we want you to look at all 10, regardless of the characteristics. If only 8 of them are appropriate and you accept 8 of them, we want you to deny or send back the other 2 instead of just letting them sort of sit there. So, but I did show like those are the characteristics just so you could see that those are how those are characteristics that are being assigned to all the clients. Okay. Sorry, Tucker.
Yep. Yeah, and so the characteristics, those show up in that icon. So rather than filtering people out, it can filter people out, but it can also just show you that information when you're looking at your pending referrals. So you can just hover over that little icon and it'll show you that information. So to accept the referral, it's super easy. We kind of were a little bit taken aback because it seems like there should be an extra step, but there's not actually an extra step. You just click on the client's name, which will take you directly to the client profile, and then you complete the program enrollment. That's all there is to it. There's not like an additional step to mark the referral as complete. When you click on the client and enroll them in the program, that completes the referral. That's the whole step to it. So there's that toggle down there. When you go to the program enrollment page, that'll be automatically on, and it's that little toggle that program placement is the result of a referral. That's what completes the referral, is when you enroll the client with that toggled on, and it'll be there automatically when the referral is to the program. So just enroll them in the program, and that's it.
And disregard this, Testy Tester has a lot of different referrals and things that we've been testing over the month. So you'll make sure that. Mm-hmm.
So right now, if I get, somebody comes in, I have to go in to programs and I click enroll, and then I have to go up and answer some questions. Do I no longer have to go up and answer those questions? You know, like date of you became homeless, you know, social, what's your income, and all those questions I have to answer now before I can enroll somebody. When this system takes over, does that mean I no longer have to answer those questions at the point of enrollment?
No, those questions are still there. Those are the entry questions. They should cascade if the client was recently enrolled in coordinated entry. But if the client has been sitting around in coordinated entry for a few months, they might not cascade in.
They don't ask those questions. When I get something from coordinated entry, and I click enroll, those questions aren't answered. Like, where did you stay last night? When did you become homeless? And then the disabilities, and is it a long disability? And then the SNAP benefits, and then the medical benefits. I have to answer those questions before that client is enrolled.
So it's my understanding, we'll check the configuration, the settings. That's strange. But actually, when you create a new enrollment, like we're referring to now, the very top section of the enrollment here, let's see, the prior living situation does in fact need to be completed, but the rest of it should cascade in, if my memory serves me correctly. So I'm gonna pull this over. So here's Tessie Tester. If I created her enrollment, which don't mind the date. This, I believe, actually this did cascade in. So all of this should be cascading in, meaning filling in from when it was filled out by the coordinated entry team. So to answer your question, in the way the system is currently configured, if coordinated entry team completes the enrollment in coordinated entry and the referral is within a certain time frame, you should have all of this data filled out when you click on enroll. If the client has been open to coordinated entry for longer than 120 days, which is possible, the system will prompt you to fill out this information because it's likely that it may have changed in that time frame.
Hi, Marie. This is Pete. I'm wondering, are you thinking that these are isolated situations, or this is how the system's working, that you're not seeing that information?
For new entries, and I won't, breach confidentiality. I can talk to you about it after. I just had one the other day from the ACI.
Okay.
Okay.
Yeah, well, definitely. If you see any issues in intake from the call center, you can certainly send me a UID, and we can research it, and I can go over it with the call center agents to make sure that everyone's on the same page.
Savan and Alex, who are monitoring and doing a wonderful job, Savan sent me one the other day and said, this person, you've reserved them a bed, but they're not enrolled in the program. And that was because it hadn't got to it yet. And sometimes
Gotcha.
the person will leave. And if the person leaves before I get to it, I have to guess. And I think we've talked about this. I'll enter that they stayed in a place not meant for habitation, and just so that I can enroll them, even though I never spoke to them or never met them. And that's not isolated, but it's not, it doesn't happen an awful lot. But
Okay.
Alex and Savan can tell you how often it happens, because they're the ones that alert me. They see it immediately.
And certainly, Pete, on the converse, if you get calls about that or emails about that, and it turns out there's something going on with maybe the system settings, go ahead and reach out to us. Just in the interest of time, it is 10:03. I want to make sure to honor all of your schedules. We're just going to flip through the next few slides quickly. We talked about accepting the referral, and here's how to check in on a pending referral.
Yep. So if you want to keep it open for longer than 3 days, you can, one thing, you can switch it from pending to pending in process. That will give you another 3 days. And if you want, or you can click check in. And if you have to check in every 3 days to keep that that referral pending to your program, if that's what you want to do.
I think this will be especially important for family shelters, because sometimes it takes the families more than 3 days to kind of get their kids, get their belongings, get, you know, everything set up where they can actually get to the shelter. So sometimes that pending in process and that check-in process will be, I think, especially important for family shelters.
Yep. And if you want to, if the referral is not appropriate or it doesn't complete, then you would change the status to denied. Then once you select denied, you would put the reason. So the type first. So if the client denied the referral, or if you as the provider denied the referral. So if the client doesn't show up, or the client says, no, I'm not going, then the client has denied that referral, and you would put that in there. And then if you select provider, and then if it's you who is denying the referral because the client is inappropriate for some reason, and then you can put that that reason. There's a drop down menu there for the reason, and then you can enter you can please. So we would love to see notes in that denial information about why that is why that denial happened, if so that we can adjust, so that we can help the system work better, so that there are fewer denials, or the denials are more just because people aren't showing up, rather than something that we can see if we can address.
I have a question about that. So, assuming you know, we accept and enroll a client at Harrington Hall. So we've accepted the referral.
Yep.
But then the client doesn't show up. Does that mean that we then have to delete that enrollment and then go back and mark this as a client having denied it?
In this process, coordinated entry matchmaker would make the referral for the client to come to your project. You wouldn't enroll the client until they come to your project to get into your bed. So the referral would be pending until they show up at your facility. If they are, for instance, incarcerated and they're about to be discharged the next day, or they're in a hospital or whatever, they're in Woonsocket and they're getting a bus pass and they're not going to be there on time, this is where you can check in and put this in process. So you wouldn't enroll someone until they're actually physically in your place, just like Marie does the enrollments when they show up. If they don't show up, that's when you would deny the referral, and the reason you would choose is that they didn't show up or call.
Okay, got it.
Does that make sense?
Yep, thank you.
All right. And then here, just for anyone who encounters any problems, you know, contact your agency manager. So all of the agency managers for all of the beta sites are involved in this training effort for the beta training. Email us send a ticket to our help desk, and then we have office hours on Friday. And then we are going to be sending out to this beta group we did already send out every single day at 4 o'clock little check-ins. People can come and, like, if they have questions, problems, like I said. But then we're also going to try to set something up for Monday, because it's the first day, just to help people walk them through making their openings, like setting up their openings. And then we're going to have a time to walk the matchmakers from the call center through, just in case that would be helpful. All right. Well, thank you, Tucker. Thank you, everyone. Any questions?
I'm gonna drop in the chat. I set up an office app, kind of an open time where I'll be on if you guys on Monday or want help while you're setting it up, while you're entering your first opening. So I'm gonna drop that in the chat, and we can send that out in preparation.
Great. Well, thank you. It's very exciting, and we're looking forward to the next 2 weeks and getting feedback and, you know, making some tweaks, updates to make everything as easy as possible. That's the goal of this, is to make it easy. No more emails, just make it as easy and sort of include it as part of your workflow every day so that it really helps lighten your workload, because we want you to be able to spend your time elsewhere. All right. Thank you, everybody. This is going to be uploaded to the LMS as soon as the recording converts. So it's usually late afternoon. So you can tell folks who missed the session, they can check the LMS late afternoon or first thing in the morning. Take care. Have a great day.
Bye, everybody.
Bye.